Thank you so much, Ajara. And I was impressed last year when you were talking you talk as a GP, and this is what you face every day. It's the social care needs that are often the issue that you can't respond to. So thank you for opening up that one, and we will come back to discuss. So now moving on to perhaps a slightly different perspective, I'd like to welcome Jane McDermott, who is based actually here in Manchester, to share her experience about working in a policy unit and perhaps some help towards us with policy. So thank you, Jane.
Thanks, Mon. So hi, everybody. I'm Jane McDermott, and I just want to talk about my role. I am Mancunian. I grew up about 500 metres from here in the city centre. I won't declare which football team I support because I don't want any fighting or any trouble at all. So I'm going to talk to you a little bit about some work that we've been doing in the Healthy Ageing Policy Research Unit. We were formerly the Older People and Frailty Policy Research Unit, and my role is Head of Collaboration and Impact. So really around knowledge mobilisation, but I also lead our public community and involvement and engagement, because it's really important to us that those things are really mapped into each other. We're a tripart policy research unit, which includes the University of Manchester, which is where I'm based, but also Newcastle University and LSE. So I'm going to give you some very brief background about what PRUs are, so you get a little bit of an understanding, and then I'm going to really focus on sort of the things that we've done, thinking about scaling impact and what does that look like. So PRUs and their current round just been funded. They started many of them this year. There's 20 of them. It's a £100 million investment from the NIHR. And we are commissioned to work directly with policy teams, mainly in the Department of Health and Social Care, but also in ARB, so NHS England and other OHID, other organisations as well. And so you can see there's different sort of themed areas, and they work on evaluation as well as being systems directed, and we sit within the life course perspective. Those that are in a different colour are 3 new units that were set up this year. And so that's what we do, and our core purpose for the Healthy Ageing Policy Research Unit is to answer questions that promote healthy ageing and inform government, health and social care policy and practice. And we do this in different ways. So we have short to medium, long-term pieces of research, things that you're probably more familiar with. So research programs that run from projects run from about 1 to 3 years. And then we also have a rapid response function. And this is between 20 and 40% of our work, where the department policymakers can come to us with any questions they may have that are arising that will help them inform the policy development cycle that they're currently working on, or it might be gaps in evidence and they want to understand what the landscape looks like in terms of evidence and understanding. And we're there to respond, and we do that in lots of different ways. It can be through meetings and consultation, but also through going away and doing rapid review work. These pieces of work can last from sort of 2 weeks, 3 weeks, 6 weeks, up to about 3 months, but they are very rapid. Central to all of our work are the lived experience of older people themselves. And when I say older people, I'm talking about anyone over the age of 50. And so I'm sure multiple long-term conditions have a very unique and very big connection with a lot of the work that we do. And we're real focus on disparities and certainly health inequalities, because more likely to be experiencing a range of different health conditions at a younger age. And so that's roughly who we are. But to talk about scaling up, I just want to sort of start off with thinking about who are our stakeholders. And this is just a snapshot of the kinds of people we always need to be thinking about when we're scaling up. And you've got there in the top right, I think, my left and right, in your top right, you'll see who are the kind of, the key people that we're working with on a sort of weekly, day-to-day basis. They're our main policy teams working through the Science Research and Evidence unit based within DHSC. But actually, we also need to think about cross-government as well and who else we're working with. We're always asking ourselves about how we're working effectively within the NIHR infrastructure, and we call ourselves account to that. A lot of our senior colleagues that sit within the PRU work across a number of different functions within and across the NIHR. And so it's really important that they're always our advocates and our champions, and they're always talking about the work we're doing across the PRU. And like the applied research collaborations, which are the implementation arm of NIHR, are really, really key in helping us sort of develop, share and disseminate the work that we're doing at a policy level. Other key people, of course, are local government, APPGs are another way that we can work together to understand calls for evidence, as well as sort of post the Parliamentary Office of Science and Technology. I've also got a picture there of the latest Keir Starmer, one of his when he first came into post, with all the mayors. These were a really important part of our community, and you need to think about how you're working with combined authorities, because I actually find that they have great agility and they are very keen to listen and learn from policy work that we're doing, that we can help inform some of their thinking as they develop, especially with ICSs and ICBs. So when we're thinking about mobilizing knowledge, I had a quick look, and very luckily, as always the case, I can't quite read her name, but I think it's Harris, did a systematic review very recently looking at what is it to mobilize knowledge, and it was published earlier this year. She's based at Bristol, and she studied, they looked across a range of different reviews, which were mainly around what works in knowledge mobilization, and she's identified these things. I would say all of those things are things that we do as a PRU. It's really important that we have everybody in the same picture all the time. We're constantly trying to make sure that we're asking ourselves, you know, who are knowledge brokers? It's not just our academics, it's also the people with lived experience that are involved in our research. They are key community collaboration partners. So these are actually key things that are very important. I'd also say, oh, I should be jumping forward. What works really well is make things very, very simple. Deliver things in really accessible formats. We use a 1325 format. So one is the one-page summary. What are the key messages? What does the minister need to know? What do people need to know to make a fast decision? But then also 3-page exec summaries, different formats as well, plain English, slide deck variations, use visual narratives. Really important. There's a really nice link there to some data visualization, which government have recently come out with. They published earlier this year. Really, really helpful to think about how you make your information really accessible so people can actually read it and understand it. In terms of the so what, it's really tricky. I've got the red card, so I'm going to have to now get off. Luckily, the so what's in red. Think about policy context. We're always horizon scanning. We're always thinking about what's coming next. And you know, I follow Wes Streeting probably more than my husband would be happy about, because I'm always wanting to know what he's doing and what he's thinking, where's thinking developing, so that I can always think about how I'm going to frame the work that we're producing in a way that actually policy teams can understand. Make sure policy teams are in every single conversation that they're having. And it's back to that stakeholder engagement, which is really critical. I'm actually going to stop because I think I'm going to run out of time. There's some stuff about barriers and issues. Policy windows change all the time. We are talking in a reflective way. We've just come out of 5 years with, I think, 5 different ministers. So actually things change quite a lot. And so I would say that you need to be mindful that the way we've kind of worked really effectively with the work that we've done is we work with regional teams and with local authorities, and that's helped us have an impact at a level that we really wanted to have an impact, because the window opens and closes at different times depending on what the priorities are. There's some examples. I will stop because I know I want to pass on because we've got another presentation. Just some examples of how we've worked with policy, but there's lots on our website, so thank you.